In my mind, it's patient care. And everything sort of gets back to that, whether it's research or nursing school or whatever it is, it really focuses on patient care. And that's the mission that I think John Seeley had in mind when the foundation was established.
I think John Seeley, if he were to come back, would recognize the dream that he had for patient care and say, this is just what I had in mind. And
I think he would be just awed by the scope and the expertise of the physicians and the scientists and the staff. So I think he would feel very, very good about what the Seeley family got started.
Mr. Seeley would be very surprised at the growth. Started out with the original hospital, and now there's over 6 million square feet that's been constructed, and there's the research that's been done and going to be continued. It's just a different era today, and I think he would be very, very pleased with the outcome.
He'd be equally as proud of the way his legacy has been managed, and we think about that a lot.
There's no doubt in my mind, and many have said, that were it not for the Seeley and Smith Foundation, UTMB would not be here today.
The legacy of the foundation, created by John and Jenny Seeley, continues to enrich the work of UTMB. And today, we celebrate their remarkable milestone of more than $500 million of support over 8 decades of service. The roots of this generosity go back to the extraordinary history of the Seeley family in Galveston. When John Seeley Sr. died in 1884, after a successful career as a Galveston banker, businessman, and entrepreneur, his wife Rebecca and his brother George were charged with managing his bequest of $50,000 for an unspecified charitable purpose. As luck would have it for Galveston, this pair shared a strong interest in the welfare of those who could not afford medical care. They decided to underwrite the building of a hospital on the island. Their desire was also influenced by the fact that the University of Texas had chosen Galveston as the site for its new medical department. But after 8 years of financial problems, the new medical department had yet to be built. George and Rebecca donated the money to the city with a stipulation that the new hospital be transferred to the university once the medical department was built. A grateful state legislature matched the Seeley's gift, and what would eventually become the state's first academic health center became a reality. This was the first instance of the Seeley family's generous use of funds as a catalyst to encourage collaborative action. It would not be the last. John Seeley Sr.'s 2 children, John Seeley II and Jenny Seeley Smith, were possessed of the same philanthropic compassion. The new John Seeley Hospital and the University of Texas Medical Branch became their lifelong focus of giving. From the beginning of the hospital's history in 1890, John would meet many of its monthly deficits. He paid $60,000 for repairs to the hospital after the 1900 storm. And Jenny and John worked together to fund the building of a women's hospital on the condition that the state matched their $50,000 gift towards building a nurses' residence hall. In 1916, John and Jenny donated another $270,000 to remodel and refurnish the John Seeley Hospital and continued to meet its operating shortfalls for the next 10 years. Then John and Jenny, along with her husband, R. Waverly Smith, made what many consider their most far-sighted decision.
As John got older, he began to wonder how this would be affected if he died and nobody else stepped forward to make up the difference. So he began to think about a foundation into which he could leave his fortune, and it might perpetuate that interest.
Over its history, the Seeley and Smith Foundation has made a profound difference on the campus of UTMB. The buildings the foundation has supported include the second John Seeley Hospital in 1952 and the current John Seeley Hospital Tower in 1978. The foundation also built the R. Waverly Smith Pavilion and the Jenny Seeley Hospital. They contributed to the Truman Graves Blocker Jr. Medical Research Building and UTMB's ongoing research facilities expansion. They funded the university's state-of-the-art emergency room and trauma center, and they provided pivotal funding for the John Seeley Pavilion for Infectious Diseases Research, which houses the first full-size maximum containment laboratory at a U.S. university. The list goes on and touches a breathtaking number of facilities on campus.
We, the foundation, want to see the money that the foundation is able to give lead to other things or help to develop a program.
We began to wonder on the board whether or not the charter restricted us too severely to handle those things that were just bricks and mortar. So we undertook a project to get the charter expanded.
The foundation did decide that it wanted to use its support to support people, and not just bricks and mortar or equipment. And I think that was a very wise decision, because after all, without people, the bricks and mortar and the equipment and other things wouldn't make much sense.
One of the things that I do with the endowment funds is to provide seed research monies to the faculty so that they can start programs of research, or to bridge the gap between the time that they have external funding for their research project and are trying to start new research projects. So it helps me a great deal in that way. And one of the reasons that we're so successful in attracting students here, apart from the reputation of the school, is because of our innovation and the fact that we have been leaders in distance education. And again, Seeley and Smith Foundation funds have helped us to move forward in those areas. So we are increasing access to our programs and enabling the best and the brightest of people who are coming into nursing to have the advantage of getting a UTMB degree.
The foundation gave a grant to help establish the ACE unit in the John Seeley Hospital, which is the acute care for the elderly unit.
And it's not your typical hospital unit at all. The rooms are twice the size of a normal patient room, so that we can have their families with the patient. They can stay as much as they'd like, and the flooring is such that if the patient should fall, if they're getting out of bed, as sometimes elderly patients do, then the risk of harming themselves is reduced. And then you move outside the unit, then we have community room so that patients can get together, and physical therapists can work with them to keep them active. Our patient satisfaction is sky high. In fact, we were rated #1 in the country at one time. And now we're, with the support of Seeley and Smith, we're expanding that from 20 beds to an additional 32 beds.
The creation of the John Seeley Memorial Endowment for Research led to the creation of a number of Seeley Centers of Excellence in cancer cell biology, environmental health and medicine, aging, molecular cardiology, vaccines most recently. And these interdisciplinary centers have really jump-started the recruitment of good scientists to UTMB and got UTMB faculty to begin to interact and to work with each other, and then to seek funding from outside the institution to support these research programs. So that's been a very important backdrop to everything that's happened here at UTMB in the past decade. More specifically for infectious diseases, the foundation has provided a very generous gift to fund the construction of the John Seeley Pavilion for infectious disease research. This is a new addition to the Keeler building, which is the second oldest building on the UTMB campus. I think the existence of the Robert Shoak Laboratory in the John Seeley Pavilion was absolutely key to our receiving the $110 million award from the NIH for the construction of the Galveston National Laboratory.
Having the BSL-4 facility, showing that we could design one, that we had people to run one, that we had people to work in one, and knew what they were doing, allowed us to successfully compete for one of 2 national laboratories for research in emerging infections and biodefense. So the Sealy Smith contributions, which was several millions of dollars, allowed us to attract $157 million from the National Institutes of Health to build this. There's many other examples of how their giving has been leveraged to develop and enhance our programs and to attract other sources of support.
Well, we're real excited that the Sealy and Smith Foundation played a seed role, if you will, in bringing the BSL forward to Galveston, and what may come down the line as a result of that.
It's about access. It's about access to health care for Galveston, which is the mission, as I see it, of the foundation. And the idea was that people were not getting service as quickly as they would like, as responsively as they would like, and we wanted to figure out a way to address that. And Harborside Clinic was the result that was presented to us by a committee that studied it at UTMB.
It has afforded us the opportunity to try new ways to improve patient satisfaction and access of patients throughout our system, making appointments to see specialists or subspecialists or diagnostic procedures. And we would not be able to afford to do that across our campus. But this demonstration clinic allows us to do it, and their generous support of that for 3 years is going to make a tremendous difference.
3 or 4 months before I was asked to be a director of the foundation, my physician asked that I get an MRI, and an MRI had just been bought by the foundation and given to the university, and I was probably one of the first dozen patients to get a chance to use it. So it hit home to me just how important the foundation's role has been at the university.
Our radiology department is phenomenal, thanks to Sealy and Smith, and not only in the core of our imaging center that they so generously supported, the renovation and the purchase of new equipment, but we have areas outside of that area. So we're very excited, and we are state-of-the-art. The other thing is our PACS system. Your image as a patient, when the test is done, it can be pulled up on a PC so that your physician, wherever he or she is, can pull it up, see what it showed, and be able to know then how to proceed. That's tremendous.
The most special project that I've been involved with since I've been on the board would be the new trauma center. It was about a $30 million project, and it's got all state-of-the-art equipment and just a first-class facility.
We're a level 1 trauma center. We are very proud of that. We treat the sickest of the sick. We have about 75,000 visits a year in our emergency room, and about 60% of our admissions to our hospital come through our emergency room. So we are very busy. And thanks to Sealy and Smith's generosity, we have an environment that's conducive to excellent patient care and support of the patient. No one wants to be in an emergency room, but when you are, you certainly want to be in one that's state-of-the-art, and that's what we have.
Giving, like the giving represented by the Sealy Smith Foundation, has tremendous trickle-down effects. If you just look at the Galveston National Laboratory, $1.4 billion projected economic impact for the Houston, Galveston, and Texas region, based on a $110 million investment. What the foundation's been able to do through UTMB not only has impact on the health, but also has an impact on the economic health, as well as education and well-being of the island and entire Houston, Galveston area.
The growth of UTMB from a single hospital to a world-class campus of over 6 million square feet has been realized through the help of many different individuals and organizations. But the school is unique in having a supporter like the Sealy and Smith Foundation. Whether offering complete funding or using its monies as a catalyst for additional participation, its focus is unwaveringly directed to compassionate patient care at UTMB.
I think we're very lucky to have a foundation of this magnitude so closely tied to the institution, and to have leadership at the foundation and in the university that can work together to realize a common vision. Because the missions of a academic medical centers such as this are multiple. And it's a mistake to focus on any one of them. And the Seeley Foundation hasn't done that. They have really contributed to our educational mission, to our research mission, and very certainly to our clinical mission.
It's the most enjoyable project that I've ever been on in my life, because you can take dollars and turn them into things you can see, really tangible things.
I think if we can continue to support the growth of the university here and at the same time support the growth of the foundation's assets so that we're able to continue to fund university projects for generations to come, I think that'll be probably as important as anything we could do.